Good evening and welcome back to the New York Immigration Coalition Test, Trace, and Take Care video series. My name is Lovely Tejada, the Manager of Community Engagement at the New York Immigration Coalition, and I will be your host. The NYIC has put together a series of videos to share information and resources about the New York City Health and Hospitals Test, Trace, and Take Care campaign and answer your questions. Now I would like to introduce Manyak Yu, who will be co-hosting this town hall with me and will share some information about Test and Trace.
Thank you so much for the introduction, Lovely. Hi, my name is Manyak Yu. I am the Chief of Staff and Executive Vice President at the Academy of Medical and Public Health Services in Sunset Park, Brooklyn. I work closely with New York City Test and Trace as well. Academy of Medical and Public Health Services is a not-for-profit organization located in Sunset Park, Brooklyn, whose mission is to identify barriers to health and wellness in underserved immigrant communities and coordinate and deliver primary care and social assistance with dignity and empathy. We offer free health and mental health services, social work assistance, education workshops, and ESL classes. In response to COVID-19, we have opened a virtual community center for services remotely and are also partnering with Test and Trace to share information and updates about COVID-19. We have also developed a South Brooklyn cash assistance program to offer financial support to over 150 families and host weekly Facebook Live workshops to discuss the latest federal, state, and local COVID-19 updates. We're distributing food and face masks to our communities every week to ensure that our families are not left hungry, with over 100,000 pounds of food and 30,000 face masks distributed to date. Now, New York City Health and Hospitals, in collaboration with the Department of Health and Mental Hygiene and other agencies, also help lead the work done by New York City Test and Trace Corp. New York City Test and Trace Corp identifies people who may have been exposed to the disease through close contact and helps them find the best place to safely separate from others to prevent the spread of COVID-19. And we help connect community members to these particular services.
Well, thanks so much for all that you and your team are doing, Manyak. Where should community members go to find the Academy of Medical and Public Health Services weekly Facebook Live?
Thanks, Lovely. You can go to facebook.com/amps.nyc. So that's amphs.nyc, or our website at www.amphsonline.org to learn more about us.
Great. Well, next we will deliver a brief presentation on contact tracing, followed by live questions from the audience. Contact tracing is the second part of the Health and Hospitals Test, Trace, and Take Care campaign. Answer the call of the contact tracers. They provide support to New Yorkers who test positive for COVID-19 and their close contacts. Learn more here at nychealthandhospitals.org/test-and-trace/tracing. What is contact tracing? Contact tracing simply means the outreach and monitoring of people who have been exposed to COVID-19 by contact with those who recently tested positive. The goal is to identify cases, trace their contacts, and recommend isolation or quarantine. Terminology. A case is a person who currently has COVID-19. Tracers will not call people who only have antibodies. If you watch the first video in the series, you know that someone who tests positive for antibodies has had COVID-19 in the past, even if they never felt any symptoms or illness. Testing positive for antibodies does not mean you're immune from COVID-19. Contacts include household members, intimate partners, people providing care in the household, and people who spent more than 10 minutes within 6 feet of someone with COVID-19. Isolation is for those who have COVID-19 and means staying home for 10 days. Quarantine is for those who were contacts of someone who tested positive for COVID-19 and means staying home for 14 days, even if you haven't tested positive for COVID-19. Every person who stays home or at an isolation hotel will help save many, many people from getting sick. So what happens when you are contact traced? You will receive a call. This is what it appears on your caller ID. NYC test plus trace, and a phone number beginning with 212-540 or 212-242. The objective of the tracing conversation is to figure out how you're feeling, educate you about your COVID-19 diagnosis or exposure, monitor every day for new or worsening illness, and identify your contacts. If you need support and services to avoid spreading COVID-19, your contact tracer may recommend a range of services, including the hotel option and food and medication delivery and resources related to stress and intimate partner violence. Contact tracers ask cases and contacts if they would like to be referred to a resource navigator for help with needs like food and healthcare and accessing medicine. The city of New York is providing a number of resources to those that have tested positive for COVID-19 and need childcare, a place to isolate, and meals. Lastly, contact tracers will let you know when you can end isolation or quarantine. You will be provided with specific instructions on how to isolate and treat COVID-19. Most important, the conversation is confidential. Contact tracing is meant to protect you, your family, and your friends. Community engagement specialists may visit the home if the person cannot be reached by phone. Tracers cannot ask you about your immigration status or social security number. Tracers will not ask for your name. They will already know it when they call you. They will not ask for your social security number, for any private financial information, credit card information, or to take control or download software to your phone, tablet, or computer. For more information on contact tracing, please check out the Health and Hospitals website and CDC website for additional resources. And that concludes our presentation. Now I would like to ask our co-host a few questions about contact tracing. What is close contact with someone who tested positive for COVID-19?
So a close contact is defined as living with someone who tested positive for COVID-19, kissing or having sex with someone who tested positive for COVID-19, providing care in the home of someone who tested positive for COVID-19, and spending 10 minutes or more within 6 feet of someone who tested positive for COVID-19.
How does the Test and Trace Corp get people's information?
If you were diagnosed with COVID-19, the Test and Trace Corps received your information from the New York City Health Department. New York State law and the New York City Health Code requires laboratories to send positive test results to the New York City Health Department. And the New York City Health Department securely shared this information with the Test and Trace Corps in compliance with privacy laws that allow this type of information to be used to protect public health and to stop the spread of COVID-19. But note that that information is not shared with any other law enforcement or immigration authorities.
How confidential is my medical history if I test positive?
Very. If you were exposed to COVID-19, the Test and Trace Corps received your information because someone with COVID-19 told a contact tracer that you were in close contact with them. And a contact tracer cannot disclose who told them you were a close contact.
How confidential are my responses to the contact tracer's questions?
Now, the New York City Test and Trace Corps is committed to protecting privacy and security of New Yorkers' personal health information as required by federal, state, and local law, and in keeping with the New York City Health and Hospitals and the City Health Department's long-term experience in guarding such information. The information that the New York City Test and Trace Corps receives through contact tracing is confidential and protected under the New York City Health Code. The New York City Test and Trace Corps will not ask about anyone's immigration status. The core database will not be linked to any law enforcement databases. Any information that New York City Test and Trace Corps obtains will be stored securely and used by authorized staff for limited purposes of protecting public health information.
What happens if the contact tracer contacts you speaking a language other than your native language or one you're comfortable speaking?
Now, if your preferred language is known ahead of time and there are tracers on staff who speak that language, Test and Trace will try to coordinate so that a contact tracer who speaks that language can call you directly. Preferred language is asked at the beginning of the call, and a phone interpreter is connected on the live call if the tracer doesn't speak your preferred language. The Corp is working to ensure that this effort is reflective of the diversity of the diversity it serves. So community groups on the ground are providing advice and support to help us deliver effective, culturally appropriate services and to address the needs of communities that have been disproportionately affected by the COVID-19 pandemic. Also, contact tracers are often from the New York City neighborhoods hardest hit by COVID-19.
Well, thank you very much, Manyak, for the helpful information. Now we have time to take a couple questions from the chat regarding contact tracing. Can you ask contact tracers to identify themselves when they come to your home?
Yes, I'll take that. Yes. So as you mentioned, if you do not answer your phone, a contact tracer may come to your home to do the contact trace interview and check on your well-being. They will show you their identification to prove that that they are a contact tracer. The same precautions, however, do apply. They will not ask for your name. They will not ask for your name because they will already know it. They will not ask for your social security number or private financial information either. And they will not ask for your credit card information. And they will also not ask to take control of your phone, tablet, or any computer devices.
How can New Yorkers know if the person calling is a contact tracer with the Test and Trace Corp?
So Test and Trace Corp contact tracers are currently working to call everyone who tested positive for or were exposed to a virus. So please do answer the phone if you get a call from New York City Test and Trace or a phone number beginning with 212-540 or 212-242.
Will anyone be considered a public charge under immigration law for receiving services from the Test and Trace Corps?
No. So getting tested, speaking with a contact tracer, or using a take care hotel to safely separate will not affect your ability to apply for a green card. Additionally, medical treatment or preventative healthcare services are not considered under the public charge rule.
Are you doing these trainings for individual organizations? Not currently. At least the NYIC is not currently doing this as an individual training, but it's included in the Know Your Rights training. Manyak, I don't know if you want to speak to that.
The Academy of Medical and Public Health Services isn't currently doing any type of training series. However, if organizations are interested in this information, we would be more than happy to schedule a presentation with your staff or provide more information to share with your team members.
Great. Well, there are no other questions in the chat right now. So I want to thank you again, Manyak, and I want to thank you for tuning in. Our next video will be on October 22nd, 2020, right here on Facebook Live. You can download and share our Test and Trace 2-pager, available in Arabic, Bengali, Creole, Mandarin, Spanish, and Russian. And to stay involved with the New York Immigration Coalition, follow us on Facebook, Instagram, and Twitter, and text NYIC to 52886 to stay up to date with our actions and campaigns. Stay safe and enjoy your evening.